Hello, I am Dr Prajwal K Rao, consultant aesthetic and plastic surgeon from Dr Prajwal's Laser and Cosmetic Surgery Center at Kanangad and Mangalore. Today we are going to discuss on treatment called as rhinoplasty. Rhinoplasty is a plastic surgery which is done to recreate the nose shape and size. Rhinoplasty is a very general term to improve the nose shape and size. We can broadly divide this rhinoplasty into two types. One which is augmentation rhinoplasty, where a patient desires to improve the size and increase the size of the nose, and this is also called as reduction rhinoplasty, where a patient wants to reduce the size of the nose and shape of the nose. So these are the both broad terms for that. And there is also something like functional rhinoplasty and cosmetic rhinoplasty. There are people who have some breathing issues, for that we do rhinoplasty, and there are people who want to just improve the appearance of the nose, so that is called as cosmetic rhinoplasty. So rhinoplasty is done for both females and males at any age group, preferably after the age of 18 years up to whatever age you can do at any age probably. Usually the rhinoplasty is done under general anesthesia, where the patient is put to sleep, and she or he won't have any pain during the procedure, and after the procedure there will be no pain as such, as we will be giving some pain medications and treatment for the same. When we tell about the nose, it is a very complex structure because it comprises of three components. One is bony component, cartilage component and a skin component. When we want to improve the nose, this is how the bony nose will look. The nose bone will be there only in the upper 1/3 of the nose. So this you can see, there is a nose bone here like this. Okay, and then there is a cartilage component which is not like a bone, it's not like a skin also, it is a medium consistency tissues. This will be there in this part of the nose, where there is upper lateral cartilage, lower lateral cartilage, and these are the things which we can improve in the nose shape. And the third thing what we comes is the skin of the nose, where we improve the size of the skin fold here and here. It is called as ala of the nose, where we can reduce it or also improve the shape of the nose. So with these three components we try to improve the nose shape and size. So most of the people come for either for reduction rhinoplasty or a augmentation rhinoplasty. When we need a augmentation rhinoplasty, what we do is we take the septum. The septum is a structure which divides the nose into two. This septum is used to improve the shape of the nose in the dorsum, so that the nose becomes very sharp and straight. If the nose is very deviated, this becomes very sharp and straight. Then if we need more tissues, because some people will not have any nose structures at all, or the cartilage will be very minimal, so that time what we do is we take the cartilage from the back of the ear or also from the rib cartilage as such. But these are completely safe, as it is completely hidden, the scars will not be seen, there will be no problems in the ear or the rib. But if we need more tissues or more cartilage tissues, then probably we need to remove from the rib cartilage. That would be the best to recreate the nose for the patients. In a functional rhinoplasty, what happens is that patient will always have a stuffy nose or difficulty in breathing in one of the nose or something like that. So usually what happens is that the septum will be going towards one side or other side, so that wherever it is deviated, he might have some stuffy nose or difficulty in breathing in that nose. For that, what we do is something like septoplasty, where we recreate the septum to improve the functional aspect of the nose. To improve the cosmetic part of the nose, what we do is we recreate the dorsum. If it is deviated, we recreate the dorsum, or if it is very low dorsum, we get another cartilage here, so that the nose is become bigger and in a perfect shape. And also some people will have a droopy tip nose, where there will be like a parrot beak appearance. For that, what we do is we use this cartilages, we recreate the cartilages, we restitch it, so that it becomes a sharp tip nose, so that you have a better nose shape. Basically in rhinoplasty, what we concentrate is that we try to improve your bridge of the nose, then tip of the nose and sides of the nose. These are the three main components what we do in the rhinoplasty. Then next comes what is the post-operative recovery after rhinoplasty surgery. Usually the surgery will take around 3 to 5 hours based on what type of surgery we do, and once the surgery is done, patient will be given a internal nasal package and external nasal package. Internal nasal package means we put a gauze pieces or ribbon gauzes inside the nose, so patient will be asked to breathe through the mouth for first 24 hours, so that we reduce the bleeding chances in the post-operative period. And yes, this pack will be removed after 1 day. Then after that we will be discharging the patient on the second day of the surgery. After that there will be an external splint which will be there, which we keep it for a week or 10 days. Basically this is to reduce the swelling and also to prevent any damage to the nose external framework. So usually when patients will be asking us when will be their final recovery, probably we tell around 10 to 14 days is the recovery period, and the results will be final at the end of 3 months probably, because all the edema will be settled down by then. So you will have a better nose shape and size at the end of 3 months. So to know more about rhinoplasty surgery and who are you the really candidate for rhinoplasty, to know such things you might need to send you a photograph, because this is a personalized treatment. And if you have any doubts on this surgery, you can always comment in the comment box below, or you can always call us in the given number below. Thank you so much.